Cancer treatment has come a long way, but there's still a long road ahead. Important advancements are being made in cancer care, and one such promising approach is personalized medicine and oncology. Hi, I'm Dr. Lakshmi, and you're watching Yashoda Hospital's The Health Talk session, where all your health-related queries are answered here. So let's discuss about personalized medicine and oncology, also known as precision medicine, in our today's episode. Joining our discussion today is Dr. Vamshi Krishna Reddy, medical oncologist and Hemato oncologist from Yashoda Hospitals, Malakpet. Welcome to the program, Doctor.
Yeah, hi.
So, Dr. Vamshi, to begin with, could you provide an overview of precision medicine and oncology and how it is transforming cancer care?
So in oncology, all these years, what we're doing was, it was like mostly one size fits all approach. So most of the times the protocols which were planned in various clinical trials, the chemotherapy medicines was almost given for everyone. But now with the current diagnostics and more newer modalities of treatment like the targeted therapy and immunotherapy, what we are trying to do is see the individual molecular signature of the patient. So it's like a tailor-made approach for each patient. So that's all about the personalized medicine. So gone are the days where we'll be prescribing medicines, same medicine for everyone. So even if we have a patient coming with a similar cancer and a similar stage, the treatment for each of these patients will be different. And the treatment will be decided based on, as I said, the molecular signature. That's where is our molecular oncology and the newer genomic tests coming into. And with this, we also have the newer targets of treatment which are coming into place. So all this will help us in treating cancer in a better way and also probably to achieve better results and probably more patients cured of cancer.
So I think that's interesting. So how do you think precision medicine is allowing personalized treatment plans for individual patients in cancer?
So as I said, once we see a patient who is probably diagnosed with cancer, we do further workup on this patient. So earlier we probably were ending with getting a biopsy and then later with a stage. So now what are we doing is after we confirm the stage and also the type of cancer, we are running further tests based on the cancer where we have now more access to this genomic arrays and the genomic tests, which probably were earlier, though available, they were expensive. Now we are seeing this test coming into the reach of common man, probably the cost coming to 20,000-30,000 for most of these tests. And once we are ordering this test, we see the result. And those patients who have these specific targets, molecular targets, we are initiating them on this specific therapies. So it's all like going and choosing the right medicine for the right patient and also at the right time. That's what is very important in oncology.
So genetic testing has a definitive role in identifying targeted therapies in precision medicine, Doctor?
I think we are done with the way we diagnosed cancers by seeing the cells. So earlier it was only seeing the histopathology or seeing the cells and telling the type of cancer. Now what we are doing is going beyond the cell. We are seeing the DNA material or the genetic material of each cell. And yeah, I think this is a vast field which is just opening up. Probably I think we'll be discussing more about this in the future because though we are doing this test, the number of targets available are still less and the benefit for most of the patients is still going to improve in the coming years. But as of today, if you ask me, yeah, we have those unique set of patients who are benefiting with this test where we are getting target in the gene and we are hitting it with the proper targeted therapy, and that is giving us great results in treating these patients.
So I think that's some incredible advancements that we are witnessing in oncology. So how do you think personalized cancer care is benefiting patients both in terms of treatment outcomes and also their overall well-being, Doctor?
Once we are diagnosing a patient with cancer, what the patient wants is they want a cure or a better result. So the therapy we just choose, they want the least side effects. So that's what is the space we are talking about. So if we are talking about, this is not in all cancer. So if you are taking, for example, the lung cancer, and once we are ordering this CGP or the newer genetic test, where we are picking up some target which probably was not picked up earlier, we can give a targeted therapy. And most of the times these targeted therapies do not have offshoot targets. So we hit it right on the target, and the side effects which usually happen because we hit other targets are not there. So the collateral damage with these newer therapies is less. So what side effects we see is mainly because of the targeted therapy, which is very minimal. So better things which are going to happen with these newer therapies is because we are hitting right on target, the kill is better, so we see better result. And because we are not hitting on the other targets, side effects are less. So that's what a patient wants. So we are seeing better results and less side effects, and definitely better survival and more cures.
So, what challenges do you foresee in the widespread adoption of precision medicine and oncology? And also, what are some recent advancements that you expect in this field, doctor?
Yeah, for precision oncology, as of now, the challenges are first is getting the test done. So we need to get on board, convince the patients to get this test done, because few genetic platforms, they cost a lakh and above. So still beyond the reach of majority of population. And second thing is, what are we going to do with the report? So once we get a report, what we see is the therapies which are going to be useful for these patients. Unfortunately, majority of these are unavailable in India, mainly for the reason that we are running really slow on the clinical trials and adoption of newer medicines. So these two are the challenge. One is the cost of the test, and later the therapy which is probably unavailable as of now, probably which may be available in the future with more proactiveness from the government and more clinical trials. That's a space where we are looking at.
So, do you think precision medicine is readily accessible? And what does the future hold, especially in this field, doctor?
As of now, I think most of us have been practicing this, the precision oncology and the personalized medicine, and we have been using this targeted therapies and the immunotherapies. What we were doing 5 years back, it's definitely, I think probably it has improved manyfold. Earlier, probably the therapies we were having was much less. Now, I think if we compare, I think probably like 5 years back, where we were treating for 2 or 3 patients with these tests and the therapies, now we are seeing 10 patients or more with this therapy. So that's the improvement. So it's still not yet touched 100%, but we are trying to see whether all these therapies and the tests are available for most of the cancers, because as of today, the therapies are available to a limited number of cancer, and again, the therapies which we choose also are limited to, again, the specific mutations. So the vast space which probably we are seeing to explode in the future with more information available, more tests, more medicines, and probably this is going to be the future.
So, before we wrap this episode, Dr. Vamshi, what message you would like to share with our audience out there?
This World Cancer Day is on February 4th. So this whole month of February, we have programs to create awareness about cancer. So what we see in oncology and most of our departments is the gap in receiving the care. So there are a few challenges, as I rightly discussed. We have challenges in ordering tests, in getting the medicines. So though we have everything available, we are not able to administer or advocate to everyone. So the gap has to be closed. And another space where we are looking at is preventive oncology. I think with us in Yashoda, we have preventive oncology also, because treating cancer after it is diagnosed is another chapter. But what we want to do is to identify these high-risk families where we want to diagnose cancer early, or at times even identify those high-risk genes and probably adopt high-risk screening for them, and probably try to prevent cancer in these families. So this is a preventive oncology. And other than this, we have vaccinations available for a few cancers, like HPV vaccine, which we have been giving for the cervical cancer, and hepatitis B is still being adopted like to mainly decrease the incidence of hepatitis B infection. And we have newer challenges like identifying these high-risk genes and going for genetic counseling, and also probably newer gene therapies which may be available in the future. So preventive oncology is being given more focus with us. And again, for those who are unfortunately diagnosed with cancer, we also have newer therapies with the precision medicine and precision oncology available with us. And also, I think we also do have the precision radiation, and also we have the latest robots for the other treatments like surgery and radiation, which are available with us. So that's about cancer awareness. Be aware, and definitely we are going to cure most of our cancer patients.
So thank you, Dr. Vamshi, for shedding light on the field of precision medicine and oncology and for some insightful discussions today.
Thank you.
So this brings us to the end of this episode. Hope this episode was informative on the topic precision medicine and oncology, and join us next week for more insightful discussions on other topics as well. Until then, take care and stay healthy. Thank you.